Good afternoon, everybody. I am Konstantina Dina Dedi. Thank you so much for dedicating a few minutes to join this webinar. And this is a brief introduction to a flagship program we have here at UCL about training of dentists in advanced aesthetic dentistry. So thank you so much for joining. I will try not to tire you so much. I will share briefly the most important elements for this program. And then we'll open the floor to questions, and we will finish with some statistics on what we find mostly enjoyable in our clinical practice or mostly challenging. So hello again, I am a prosthodontist, and I spend half of my time in dental education in challenging procedures, mainly involving reconstruction of dentitions or challenging aesthetic cases, interdisciplinary cases. And the rest of my time, I divide between patients and my postgraduates. The first part of my career was in the United States. I was with University of North Carolina on academic faculty. And since 2007, I have been delighted to be with UCL. And we created this program and we launched it in 2008. So this is a very formal flagship program with a big alumni base that started in 2008 and has evolved a lot through the years. What do we teach? This is a program primarily for inspired clinicians. We would like to help colleagues who want to enjoy interdisciplinary aesthetic dentistry and get the tools and the knowledge to be able to meet with confidence cases of patients of high aesthetic demands, cases that they are challenging, that they require a lot of evidence-based thinking outside the box, and also to be able to confidently meet the questions or even the complaints of difficult patients. So basically, we want to empower the colleagues to be able to enjoy dentistry on cases that they are very creative and they enhance function and appearance. How is the program structured? We have a lot of hands-on. The interesting evolution for this program is that we run simultaneously 2 modes of attendance. So for colleagues who are in the London area or nearby London, we meet usually once a week and we explore the topics with interactive lectures in the morning, continuing with hands-on training in skills lab or clinic. So with a brief recent comparison, we provide the most hands-on training in aesthetic dentistry on part-time programs in the UK and Europe with a current search. Okay, we give a lot of hands-on. Our overseas participants can attend the mixed mode of attendance, so they can attend the weekly lectures live via streaming. So when we teach in the auditorium here at UCL, at the same time we stream via Zoom for our overseas participants. Then they can come 3 times in London to do the same hands-on training, but instead of doing that every week, they do condensed training blocks 3 times a year, usually December, 1 week in December, 1 week in March, and 1 week in June. So we can cover attendance based on the participant's location with the offering of these different time scales. So what do we learn? We follow the journey of the patient from the beginning, how to approach the case, how to examine, what information to collect, what records do we take. And we teach now not only traditional records, but also digital. So we learn both ways. Then, how to plan the case, how to approach an interdisciplinary case, how to incorporate feedback from other specialties. How do we present to the patient, and how do we test drive the result before we even start? This is, we teach extensively 2 types of mock-up process, which are crucial for our aesthetic composite, veneers, or anterior reconstruction cases. So we need to confirm the shape as far as function and as far as aesthetics before we start, restoring the teeth. So then we go through the bundle of ceramic of indirect restorations. So we teach very extensively, step by step, veneers, from the planning, from the preparations, temporization, impressions, and cementation, anterior crowns, ceramic crowns, posterior crowns, inlays, onlays, and then we also have rotations of periodontal plastic surgery, atraumatic extractions. How do we do an extraction when later we need to place an implant in the anterior zone, or when we have an aesthetic pontic coming there? How do we approach such cases when we have a gummy smile, aesthetic crown lengthening, for example? How to plan and restore, temporize, and also provide the final restorations for implants in the aesthetic zone. We incorporate that as well. And then we also cover direct restorations. We have our own technique for anterior composites, for bonding, or for peg laterals, or for closure of diastemas. We cover layering. We expose our participants to several composite systems. Posterior composites, how to protect the pulp, how to neutralize C factor, how to give good contacts, how to do the morphology the quickest way we can achieve, how to give aesthetics. And finally, we approach larger cases, interdisciplinary approach of full mouth rehabilitation, tooth wear cases, dull appliances, how to protect dentitions when they have signs of wear, Michigan splints, our impressions, direct impressions or digital impressions. And the way we approach the everyday clinical procedures, we like to give structure, a recipe, if you want to call it. We have the 7 steps of veneer prep, 7 steps of crowns, 7 steps of onlay preparations. Finally, we have a heavy element of interdisciplinary treatment planning. We present cases, we discuss the cases, and we see how step by step we can execute them. And this is a more recent addition, the treatment planning sessions, and our participants, they find them extremely useful because it's the real thing. We see how we can approach them. Occlusion as well. What are the elements that we need to be careful, and how we can design an occlusion that will give longevity to our restorations? What are the risk factors of each case? So a lot of elements, it's quite creative, and we have a strong interaction with our postgraduates. And when we do training in the skills lab or clinic, a small group setup where we have an instructor per 4 to 5 participants. Now, how that evolves further. This is a prestigious university degree, and we have some exams. So the colleagues who spend the year with us, they will have an MCQ examination every June, an essay on a topic that is of current interest, and we help them how to develop it. And if they want to present it as a publication for a journal, we can do that as well. And finally, the most exciting examination is at the end. We have a viva examination. The colleagues bring a case they have treated independently. They present to the examining committee as a portfolio case, and some questions are asked. So this is the program. It's a quite busy program. It's a quite interactive, very interesting, and quite enjoyable from what we see with our alumni every year. We have imminent plans to evolve this to an MSc, and this is something we work at the moment. And our next step after this first year, we aim to have supervised clinical care for the participants of the MSc. So I don't want to tire you further. I think it would be most interesting if we open the floor to questions. But before we do that, I would like to finish this brief introduction with 2 questions. I've been an educator in clinical dentistry since 1998. Please do not calculate my age, but we have a lot of experience seeing and helping many colleagues, either through specialty training or through postgraduate education. And I always advise, if you are looking to further your education, just ask, where would you see yourself in your ideal professional setting in 5 years from now? Just have a mood board. Imagine yourself. Sky's the limit as far as careers, and let us know, because we can help you achieve that. So thank you, and let's see what if there are any questions.
Thank you, Dina. I will now launch the 2 questions for our audience. And I'll give a minute or so for our guests to select their answers.
I attempted to vote, but it didn't let me. But
only our guests.
Yes, I know.
Vote. Give it 10 more seconds, and then I will share the results.
What I wanted to add is that after this presentation, I know you have registered with initially, so we will send you, we will send you the information on the program and some other useful links, okay? All right, so a lot of people, wow, okay, composites, direct anterior composites, okay? Posterior composites, yes, it's our everyday bread and butter in dentistry, I guess. And veneers, yes, I love doing veneers as well. I love developing them. You can change somebody's smile and life, actually, with something like that. And it's not only aesthetics. We can reinforce the teeth, especially if they have lost rigidity from multiple restorations or wear. Anterior composites, they can be more tricky. That's why we spend a lot of time developing our own palatal matrix technique. It's a bit different from what you may have seen on the Instagram or in other courses. Let's see the second question. Okay, all right, veneers. All right, with veneers, yes, I agree. They are very, very, they are conservative restorations, but if they are, it's very easy to make a mistake if you don't have structure. So what I advise for veneers, I have two advices, okay? First of all, very good risk assessment. The 2 elements that they can fail a veneer case is lack of enamel, and if the new length is not protected occlusally, those 2 things. So these are the 2 things that we need to assure in order to have longevity. And the main advice is you calculate how much you grind into the tooth from the mock-up and not with the tooth surface directly, okay? So very, very important. You know, we put the mock-up on and we drill as if the mock-up was the real tooth. And then they become extremely conservative. There is a lot of criticism now with the media. A lot of patients come scared, having seen some very aggressive preparation pictures in the internet. And they say, well, I don't want my teeth to be ground. Veneers are a very conservative restorations. Ideally, we need to stay entirely in enamel. And the important technique is that you fuse the mock-up and you start grinding with depth cuts from the mock-up, from the plastic, not from the patient's teeth directly. Okay. Now, I guess, do we have any more direct questions for me from our participants? I think we can put them, Emiliana, can we put them on the chat?
Our guests can write questions in the Q&A box. So please feel free to add any question in the Q&A box and we will read out for you and Dina will kindly answer any of your questions about the programs.
What we can do, if you don't have ready questions, when we send you via email the materials, I will put my direct email as well, or my Instagram profile. And you can then, if you think of a question, or if you want to have something, more information on the program and the topics, then you can email me directly.
We do have one question.
Okay, all right, let me see. Okay. Would we learn anything lab techniques or will just be taught? Yes, no, how to liaise with labs. This program is not for dental technicians. And because it's a part-time program, we don't have dedicated time to do lab procedures. Now, if you were coming to train for specialty training, okay, when I did my program in prosthodontics, we had to do a lot of our own lab in order to learn, okay? But now what we do, we see how we can design digitally, but the emphasis is very good clinical execution and how to liaise with labs and how to write very detailed prescriptions, because even how to select your ceramics, where to select if you're going to have the ceramic milled, if you will have it monolithic, if you need layering, how much layering, these kind of things. So excellent communication. So not to rely on your technician to make choices as far as materials, okay? We give them all the information what we want and we expect perfection. So it's mainly communication as far as the lab procedures. But we need to have knowledge of how prostheses are created in order to be able to request the proper prosthesis for your patient.
Thank you, Dina. We do have another question from Christy. Thank you for the lovely presentation. Is it possible to share the list of topics which will be covered in the PG Cert? Thank you.
Absolutely, yes. That will come because it's a big file. It has like 25 separate topics that you will receive it in the email we will send. And I will give, the document will have a detailed collection of what happens each day.
Thank you, Dina. And one more question. Do we get allocated a tutor for our practice cases or mentoring support after the course?
During the course, okay? So during the course, we have the treatment planning sessions, okay, where there are cases that I select, the cases that they are quite challenging, but also the postgraduates, they bring cases and we give advice. When we see a case, I teach them how I want the case to be presented, okay? So we need to have full radiographs, we need to have photos, we give a specific, we teach dental photography as well. So we have a collection of photos that we need to take for the case and we discuss the case. Now, after the program, when you graduate, no, because imagine, I have alumni since 2008. If we were treatment planning for every postgraduate who has graduated, probably I would have needed to have a team doing only that. But we empower you, we give you the tools. You won't need me anymore after the program.
Thank you. Any more questions? Yes, we do have one more question. Do we need to have any clinical experience beforehand?
Absolutely not. And I've tested that, okay? The first years of the course, we were asking for 2 years post-qualification clinical experience. And we realized that we had young dentists recently just graduated who would do miracles. For example, one of our postgraduates, he came to us like right after graduation, and now he's one of the top prosthodontists in the US. He excelled, okay? And we had colleagues who were practicing for many years, and we found that when you practice for many, many years, sometimes it's hard to shed all habits, okay? So the answer is no. Actually, the sooner we meet you after dental school, the better it is, because you start learning in detail through our program. So you don't need to have experience. We welcome you out of dental school.
Thank you. Thank you for clarifying. Any other questions? This is your chance to ask questions directly to our program director.
All right. What I'll do, can you see on the chat? Can you see the chat?
You can broadcast to everyone in the chat if you like.
Okay. So what I'll do, because I see people may have questions after, I will put my direct email. Okay, it doesn't go.
I can try your UCL email.
Yes.
I can try.
I try to do the chat, but it's not sending it.
No worries, I can try.
Okay, or I may put it on the Q&A. I'll put it on the Q&A.
I've just broadcasted now.
Okay, yes.
hey.dedi@ucl.ac.uk.
Yes,
in the
so
chat.
if you remember of any other question, feel free to email me directly, and I will put my Instagram profile as well, if you prefer to use that platform. It's dr.dina Dedi, D-I-N-A-D-E-D-I.
I try also to put on the...
Yeah, so this is at dr.dina Dedi as one word. Because for some reason, a lot of colleagues prefer this platform. I get a lot of questions through the Instagram platform.
I can put in the chat as well.
Yes. And then let me see, I think we have another.
We have 2 more questions we can go through.
Yes. So,
well.
all right. So as online, we need to have 60 credits. How many hours are these credits? Well, no, it's not like the CPD credit hours. Credits, these are university credits, okay? So hours is you have from between September, end of September or October, let's say, to July, almost every Thursday, from 9:30 in the morning to 4:45. So this is the part-time program, okay? So for the mixed mode, on those days, okay, you have the lecture, and then you come in separate trips to London to do all the hands-on that was achieved on those times. So it's not CPD hours. The 60 credits are university credits. These are the credits that they award a postgraduate certificate qualification. As far as credit hours for CPD, it's a lot. It's, you can calculate, I don't know, 6.5 hours times all these Thursdays. It's a lot of hours. They get, in addition to the university degree, they get also verifiable CPD hours that they are a lot. You calculate 6.5 CPD credit hours per Thursday. So I don't have a calculator, but you can do that. And I think we have one more question, isn't it? Let me see. Christy? Yes, there are. Now, I don't have the numbers, but what they do, what they prefer. Most of our alumni, they go into successful private practice. And when they apply for competitive private practice positions, like, for example, in the West End area in London, the people know how much hands-on, various programs give. So our postgraduates are very well received. We had several of them who had continued with prosthodontics and several of them who have continued with prosthodontic training in the USA, full scholarship. So it depends what they want to do. But a lot of them get inspired and they continue further.
Thank you, Dina. And we do have one more question. For the clinical referees that are required for the application, if you are recently graduated, could this be clinical tutors or trainers?
Yes, absolutely. So you don't need, if, let's say, the clinical tutor or trainer or whoever writes the reference is not academic, it doesn't matter. What I get a notification from UCL, oh, this reference is not from an academic institution. Do you want another one? And I say no. For me, when I examine somebody's application, the most important thing is the statement, okay? I want to see if they really want to do aesthetic dentistry, what they really want to do, okay? And to see if they will benefit from the program. Why do I say that? Because we get occasionally some applicants who say, I just want a program for me to come to the UK. So this candidate may not be suitable for the program. But if they write, well, I'm a dentist and I want to be able to treat complex cases, or I want to be able to confidently, do smile rehabilitations, veneers, all that. Yes, this is the right candidate. And that's important.
Thank you, Dina. It's very important to clarify as well. And we do have another question from Sania. Does this contribute towards the master in aesthetics?
Yes. So basically, when we launch the masters, we are hoping to launch 2025. Okay. So this year would be the first year of the master. So the people who would have graduated from this program in the last 5 years, they would be eligible to continue, to apply and continue. Continue not from the beginning, but continue from here too. So use this one when the masters launch. This one will be the first year of the masters. And people can choose. They can do only this year or they can continue for the masters.
That's great. Thanks.
It will be like the masters will be the evolution of that. It's not going to be something totally different. This one will be the fundamental first year.
Thanks.
And I think we have one more. Let's see. Okay, yeah. Thank you, Sanya. Now, what we do later in the year, we also have for the colleagues who are close to London, later in the year, we'll have also an open house here for the facilities. So people who are available that day in the vicinity of London would be able to come in and see our facilities. We have state-of-the-art facilities, full digital suites, everything latest. We moved into this building right after COVID. So this is like a very, very superb clinical facility. So we will do also an open day where you can come in and meet us in person and see the other postgraduates and see what we're doing, see the staff. But that we do that usually closer to June, probably May, June.
That's right. I'll put a link to the Eastman Dental Institute.
Perfect. And then I guess, Emiliana, we the central database, we have their emails to send the documents, isn't it?
We will send all the participants the documents that Dina just mentioned.
Perfect.
I expect this probably next week now. Yes.
Yeah. All right.
If you don't have any other question, then we might want to end here. And as Dina said, you will get that documentation and also the email address that we also shared. And then you can always ask questions afterwards. But I do see that there is another question in our Q&A. Is there a MSc in aesthetics already in UCL?
No, it's not already. This is the only flagship program. It's nothing else.
Not sure whether the question is about dentistry, aesthetic dentistry. I think maybe you can clarify.
Well, we talk about dentistry. This is
No, I think I'm asking our participants to clarify because this is aesthetics dentistry.
Yes, no, if you go to the main UCL website, there is the surgical department in the medical school. They have aesthetics, for non-invasive, procedures, but that's a different thing. It's not dentistry. So this program is for aesthetic dentistry, okay? This is where confusion may have happened, because when you look at the portal of all the programs, there are some MSCs from the medical school, but this is surgery. It's not dentistry. It's a different story.
And we have a question from Shreya. Thank you for the great talk.
Hello, Shreya. We've talked before, I believe, no?
And how would we find out when the open day is? Will it be on the UCL website? The answer is yes. It will be advertised on the main website.
Yeah.
And normally we tend also to send out an email to whoever registered their interest in dentistry.
Absolutely.
UCL.
So Shreya kindly communicated with me as well. So what we do when we have that, usually we send it to all our interest list. And we put it also on the website as a taster day, like an open house day.
That's right.
And I think there is another one, no? Oh, okay, fantastic. Thank you. Great. Excellent. And it's very productive day when we do the open day, because what we do, you see the other postgraduates in action. You see them, how they work on their stations. You see how their preparations evolve, for example. We were looking, my postgraduates at the moment, they are in skills lab, but I had invited a few to come join me here, but they are still preparing teeth. So they didn't want to do that last minute. So, but during the open house day, you can mingle with them and see their preparation, see how they prepare, we have specialized kits, for example. We have our own diamond burr selection kit, because we want to have the necessary shapes for preparation set for composites. So, so you will see their work, and you will see the types of exercises we do. A list of faculty. Interestingly, no, we haven't updated that. We can provide it in the documents as well. Now, the guest lecturers that I invite in vary per year. For example, we have a very nice lecturer for composite layering, Alex Papp, she's very famous for the anterior bonding, and she's been invited this year again. Next year we have somebody else. We have a core faculty, and then we have also visiting lecturers. We can put for this year on the documents we will send you as well. We can add that list. That's actually an excellent point. Thank you.
Okay, I'm sharing Dina's email and Instagram again for anyone that joined a bit later. And then if no other question, then we can leave you here.
I want to thank you very much as well. Thank you so much, Emiliana, for organizing, and thank you very, very much for giving us your very precious time. Thank you for that. And don't hesitate to contact me if you need additional information, or if you need some advice, and if you are evaluating options in furthering your career. And as I said, I will send you info. We will send it via email, and keep enjoying your dentistry. It's a fun profession. Thank you so much.
Thank you, Dina. Thank you to our audience.
Thank
Have
you.
a lovely evening. Bye.
Bye-bye.